An appendectomy is a common and necessary operation. And it is the surgical removal of the appendix, a small finger-shaped pouch that projects from your large intestine. When the appendix becomes inflamed and filled with pus, a condition known as appendicitis, it must be removed to prevent it from rupturing. This procedure is one of the most frequently performed emergency surgeries in the world. It alleviates the intense pain of appendicitis and prevents a more serious, life-threatening infection from spreading throughout the abdomen called peritonitis. The goal is to intervene early, making the surgery a straightforward and successful solution. There are two primary ways a surgeon can perform this procedure. The most common method is laparoscopic surgery. It uses several very small incisions in the abdomen where a tiny camera and specialized instruments are inserted to remove the appendix. The alternative is open surgery, which uses a single larger incision in the lower right belly. Open surgery is often necessary when the appendix has already ruptured. There is a significant infection. The patient has prior abdominal surgeries with scar tissue. The type of surgery influences your recovery timeline and hospital stay. After a routine laparoscopic appendectomy, many patients go home within 24 to 48 hours. Recovery is often quicker, with less pain and a faster return to normal activities. If you had an open appendectomy or a burst appendix, your stay will likely be longer. You may need several days in hospital to receive intravenous antibiotics and for the medical team to monitor you for post-operative complications or spreading infection. The decision between laparoscopic and open surgery prioritizes your safety. A ruptured appendix releases infectious material into the abdominal cavity, which requires thorough cleaning, easier to do through an open incision. Pain is an expected part of the healing process after any surgery, and after an appendectomy, you will likely feel soreness and discomfort around your incisions and within your abdomen. For most people, this pain can be effectively managed with simple over-the-counter medications like paracetamol, also known as acetaminophen, ibuprofen. Your doctor will provide guidance on the correct dosage. If you had open surgery, your pain might be more significant, and you may be prescribed a stronger pain reliever for the first few days. Stay ahead of the pain by taking your medication regularly as directed, rather than waiting for the discomfort to become severe. A peculiar but common experience after laparoscopic surgery is shoulder tip pain. It's not a shoulder injury. It's caused by carbon dioxide gas used to inflate the abdomen. The gas can irritate a nerve that travels to the shoulder, causing referred pain. It's harmless and usually resolves in a day or two as the body absorbs the gas. A warm compress or heating pad on the shoulder and changing positions often can help. Proper wound care is simple but vital to prevent infection. Your incisions will be covered with dressings or small adhesive strips, called steri-strips. Keep the area clean and dry. You can usually shower gently 24 to 48 hours after surgery. Avoid scrubbing the incisions. Let soapy water run over them and then gently pat dry with a clean towel. Do not pull off steri-strips. They should fall off on their own in about a week or two. Avoid submerging wounds in a bath, a hot tub, or a swimming pool until fully healed. Vigilance is your best tool against infection. While complications are not common, it is important to know what to look for. You should contact your doctor if you notice any signs of a developing infection at the incision site. Increasing redness that spreads, warmth to the touch, significant swelling, any yellow or foul-smelling drainage from the wound. Other red flags that warrant a call to your surgeon's office include developing a fever higher than 101 degrees Fahrenheit, 38.3 degrees Celsius. Movement is a cornerstone of a healthy recovery. Getting up and walking as soon as you are able is one of the best things you can do for your body after surgery. Gentle, short walks around your house promote healthy blood circulation. This reduces the risk of developing dangerous blood clots in your legs. Walking also helps get your lungs working properly after anesthesia, and it encourages your digestive system to wake up and return to its normal rhythm. Start slowly, with just a few minutes of walking at a time. Gradually increase the duration as you feel your strength returning each day. While walking is encouraged, heavy lifting is strictly off limits for a period of time. Your abdominal muscles need time to heal without being strained. Don't lift anything heavier than about 10 pounds, roughly the weight of a gallon of milk. The specific timeline depends on your surgery type. For a laparoscopic procedure, avoid strenuous activity and heavy lifting for at least 2 to 4 weeks. After an open appendectomy, recovery is longer. Avoid these activities for 4 to 6 weeks or as advised by your surgeon. Return to your normal routine, including driving and work, gradually. Do not drive while taking narcotic pain medication. These drugs impair judgment and reaction time. You must be able to make a sudden stop or turn without hesitation or pain. Most people feel ready to drive about 1 to 2 weeks after surgery. Your diet in the days following surgery should be gentle on your digestive system. The immediate goal is to stay hydrated and provide simple, easily digestible nutrients. You will begin with a clear liquid diet, water-clear broths, apple juice, herbal tea. These fluids are easy to process and help prevent dehydration. If you tolerate clear liquids well, you can gradually progress to a soft diet. These foods require minimal chewing and help you regain strength without discomfort. Once ready for soft foods, think smooth, gentle textures. Mashed potatoes, plain crackers, white rice, plain pasta, applesauce, ripe bananas, well-cooked, soft vegetables. Dairy, yogurt, cottage cheese pudding. Eat small, frequent meals throughout the day. Focus on protein and hydration as you heal. Protein fuels tissue repair. Lean proteins. Baked or poached chicken, fish, scrambled eggs, tofu. Continue drinking plenty of fluids, primarily water. Slowly reintroduce fiber from cooked vegetables and soft fruits to help regulate bowel movements, but do it gradually to avoid gas and bloating.